Hi, so this is a little video for those of you who are struggling with your backs. My phone isn't staying very stable today. So quite often the back is in spasm because it thinks that you're not going to protect it, so it's going to really hold it. Now sometimes I struggled with this for years because I felt that there wasn't a need for medication, but sometimes there is a need for medication. You just need something that will relax the back enough for you to move it and get it moving again once it's moved out. But these are some ideas that you can try if you've not got yet to that point. So one of the things that people do, or that I try to get people to do, is to just do these few exercises. So to do a shoulder bridge when you're in spasm is quite painful, but what you can do is just tip and tilt. Just gently move the pelvis if that feels okay to you. If it doesn't, obviously you don't do it, that's fine. All you're doing is rocking the pelvis. We're not going into anything big. The arms go out and we drop the knees to the side. Now when you're in spasm, it's quite difficult to let your knees go down very far. So what you can do, I've got a couple of blocks here, but you could use a couple of cushions and just allow the knees to rest on the blocks. And then the whole point of this is that you relax the muscles that are in spasm. And the way you do this is with your breath. So you need to take a breath in and exhale. Just let it go out through the mouth. And you want a longer exhale than you do inhale. So you may breathe in for 4, hold for 2, and then breathe out for 6. And just focus on the breath. If the counting gets too much for you, then just simply try and breathe in as long as you can, and then breathe out for longer. And while you're focusing on your breath, your body is being distracted from the pain and it's starting to think about how you're breathing, and you may find that those muscles will really relax. And of course it's important then, I would stay 45 seconds to a minute on one side, because you really need to let the body relax those muscles. And then of course you need to do 45 seconds to a minute on the other side. Now you may start off, I'm starting off with 2 blocks on that side, but after you've done this a couple of times, you just rest your knees on the block and let the body really relax. And I say the focus is on the breath. You may feel a bit of a pull straight away. It shouldn't be painful, but it may feel like it's a pull as those muscles are quite tight and sore. You just stay focusing on your breath. Maybe just count 10 breaths. And then when you go to find that you do it on the other side again, when you come back again, you may find that you're now down to 1 block. It may find that you're still at 2, but just take it nice and easy and rest with the body in this position. And the other thing that you can do, I'm going to use a little table here, but you can use a little puffy or a stability ball is good. I'm just going to use my little table there. I'm going to put so I may sort of be in a little bit of pain here. So you just relax down, you put your legs on the table. Put your legs on the table. And try to make sure that you're right supported up into your knees. I'll bring this table a little bit more towards me. And this should be so that you've got a nice 90-degree angle with you. And again, all you're doing now is just focusing on that breath and just feeling that the body is sinking or melting into the floor. Sinking or melting into the floor. So this is just when you have a back that is in absolute spasm. It's very difficult to do something with it. Again, there is a time when you need to take medication in order to release the back, because after you've released the back, whether you can do it with medication or you can do it like this, you then need to start moving that back so it doesn't get stuck. So again, you're just trying to keep the palms upwards. It opens the chest up as well. Just focus on breathing in as deeply as you can. And breathing out. and breathing in and breathing out. And you just do this for about 10 times. And then when you feel that the muscles started to relax, you can take your legs down and you can just roll over onto one side. Let the body relax here. And hopefully you can feel that the muscles are a little bit more relaxed now. So I hope that helps some of you who are finding it in spasm. You don't need to do anything, because sometimes to do something is creating more spasm. What you need to do is relax the body. So these are a couple of ways where you can relax the body, just focusing on deep breathing. The breathing is everything. Your body's listening to your breath. And as your body starts to slow that breath down, the body starts to relax a bit more, and then you'll find that the spasm will be less and you start to increase your range of movement. Okay, have a great day.